Okay, sorry folks, we ran a little bit late there. My technology, my bad. Uh, Deficiency on my end. So we're talking to Ms. Monica Alfaro from La Familia Del Paso. And we do have an interpreter. Before I go any further, Ms. Monica, could you just introduce yourself and Ms. Madrano?
Yes, well, my name is Monica Alfaro. Like you stated, I am with La Familia Del Paso, and we also have Liliana Medrano, and she will be assisting us with the sign language today.
And then, you know what, Ms. Alfaro, I want to applaud you for helping us with the sign language. I do appreciate that. Okay.
Thank you to Lily.
Full disclosure here, folks. You know me, I like to tell the truth here. I'm not gonna lie, Miss Monica is my cousin, and I didn't realize that she worked for La Familia. I did, but I thought she had left. You know, so she is my cousin. So if I call her Monica, it's because she's family. I don't really call people by their last name. So basically, we're going to do today. We're talking about mental health, which is very important in these times because mental health, as Ms. Monica is going to tell us, you know, it comes up on you. Sometimes you don't realize what's happening until it's too late. And especially now that, you know, I think I saw there's 45,000 people in El Paso that are unemployed. The food banks has lines forever. I think the last time I saw it was like 1.6 miles for the last video that I heard about. So first of all, Ms. Monica, can you just tell us what La Familia does? Or what, just a little synopsis before we go any further, like what the programs they offer.
So La Familia del Paso, we do help individuals who are suffering from behavioral health or mental health issues. We do help individuals suffering from depression, from bipolar, from schizophrenia, from anxiety, ADHD, ADD. We are serving adults and children starting at age 5 and up.
And so people can understand, because sometimes what happens, Ms. Monica, you probably know, they misinterpret mental health in regards to intellectual disability. There's a difference, right?
Yes, there is a difference. So the difference between mental health and IDD, which is intellectual developmental disabilities, is that IDD is the new terminology used as before when we used to use it as mentally challenged and mental retardation. So we don't use that terminology anymore. So we've transitioned into IDD.
Okay. And then mental health, someone that didn't know, like, for example, because you don't know, honestly, do you really know, like, when you're getting depressed or when you, what's the signs? And you're telling me, but there's like stages that you want to keep a lookout for. And I want people to understand that when they're listening, they might not understand, or they might not feel like you're being getting depressed or other mental health diagnosis. What do you tell people to look out for?
What is very important is that if the symptoms last more than 2 weeks. So if you see that, you know, you're depressed, you have no energy, no motivation, you know, you're sleeping in, you're not eating, or vice versa, you may be eating too much. But if you see that those symptoms are lasting 2 weeks or more, it is very important that you do seek professional help. Like I tell a lot of people, you know, there's no risk at seeking professional help. So it's very important that if you do feel it, it's better to just go set up an appointment and find out if you need further assistance in order to catch it at an early stage.
And that's where the Paso steps. And then, first of all, if someone wants to let's start with this. If someone wants to reach out, what's the phone number there?
So here at La Familia del Paso, our telephone number is 915-239-2955, and just ask for the intake department.
So let's say just do a scenario here, okay? We'll play act here. So let's say I think I'm getting depressed, or I can't do anxieties, or I'm having thoughts of suicide or anything like that. Well, suicide there's more drastic, but when I call, and I know you're doing an intake, will I be seen by a doctor or a nurse, or how does that work?
What happens is that we do have intake staff that do take the basic information. So we do take like your name, address, date of birth, and your insurance information. We also have a self-pay program for individuals that do not have insurance. So we know lots of El Pasoans or people in the community, we lack that. We don't have the health insurance because we can't afford it. However, we do have a self-pay where the initial visit is $150, and that covers the psychiatric evaluation as well as the prescription for medication if needed. So that helps a lot of people, wanting to seek that. And I tell people that it is very important that in case they do feel that 150, it does cover, and if the prescription is covered for about 3 months. So the psychiatrist will go ahead and want to see you again in 3 months, of course, to see how you're doing and also to provide you with that refill. Also, when you call the intake, we take all that information, and at the time of the intake, we do set up the appointment. So it's not like, oh, we'll call you back, we'll see what available appointment we have. No, at the time of the call, we do provide you with that set appointment.
So who's eligible, or what? In other words, you said self-pay, but what insurances or can someone use if they want to participate? I know you have other programs. We'll talk about that later. But what right now, who's basically covered or eligible?
Okay, so right now we are accepting Medicaid. So we are accepting Molina, Superior, AmeriGroup, and El Paso First. We are also accepting CHIP and Blue Cross Blue Shield, PPO, and Federal. We are working right now with TRICARE and also United Healthcare, but we're not in the process. We're not credentialed yet, but we are in the process of getting credentialed with them pretty soon. So I say maybe like in the next 2 to 3 months, we should probably be hearing something.
TRICARE, is that like the veterans, military, or what is that?
Yes, veterans.
Okay. So have you, like you right now, Ms. Monica, have you seen an uptick in people calling in or taking advantage of services right now regarding the pandemic?
I think what's happening is that maybe many individuals feel that the services are not open, but we are accepting new patients. So right now we are accepting new patients only by appointment. So of course, if you want to set up an appointment, you do need to call, set it up with the intake department. If you are comfortable with coming in, we do have a psychiatrist or a nurse practitioner that is willing to see face-to-face new patients, of course, with precaution and modifications as needed. Mask, making sure that they're the only ones that are coming into the office. So we are taking precaution as much as possible. Also, for the individuals that are not comfortable with coming into the office, we are setting up phone appointments for that as well.
Okay, so that's I haven't left the house in 5 weeks, so that's probably me right there. But I gotta tell you, Monica, why is it? I mean, we talked about mental health, and we talked about the differences between the intellectual, your services, but honestly, what's the main reasons that someone should seek help if they think they need it? Because sometimes they'll say, "No, I don't want to call because they might put me in the hospital," or "No, they might do this," but they didn't really need it. How do you encourage them?
There's a big difference between inpatient and outpatient services. So inpatient is, you're talking about like the psychiatric center, UBH, the other hospitals that are inpatient where you need to stay there. As far as our clinic is outpatient. We do not encourage hospitalizations. That's the reason why we try to go ahead and serve you and I guess make your life better before it gets to the point where you need to get hospitalized.
Exactly.
So once you come in, our main goal is, like I said, not to get you hospitalized and to get you the best care that we can possibly give you.
And if those who are listening and watching, I hope you understand that it's not a negative thing to reach. If you think you're having issues, reach out. It's not you're going to be tagged and everybody's going to know. And no, it's something that really needs to be, just as people exercise, go to the gym and, hey, you meant to exercise and have good mental health. And, if La Familia Del Paso is a good resource if you think you're having issues. What's the phone number one more time, Ms. Monica?
It's 915-239-2955.
And what's do you have a website?
Yes, it's lafamiliadelpaso.com. We also have emails in case you want to go ahead and send consumer relations, of course, to referrals at lafamiliadelpaso.com. So you can go ahead and maybe ask us questions, and we can go ahead and answer it via email. We can go ahead and do that as well. But if you need more information that's, you know, more confidential and want to make sure that we're speaking to the correct person, then we will ask for a phone number so we can make contact.
Cool. Oh, just for people who are listening and watching, if my dogs start barking, it's because I don't really kick them out, but they weren't listening to me. So you may hear some barking. I do apologize for that. But anyways, so want to talk about the other services real quick about what La Familia del Paso also has. I know you have a clubhouse. You have like
Yes.
several facilities. So could we talk about that real fast?
So the clubhouse, that was our original founded place. That's basically where everything got started. That clubhouse, you are not required to go through the intake process. It's basically like a clubhouse, you know, people with mental health diagnoses go and they socialize with other individuals that do have an MH diagnosis. And, you know, they play loteria, they just socialize and so forth. They do have requirements out there. You do have to be 18 years and over and participate at least 2 to 3 times per week.
Oh, you do? Okay.
Mm-hmm.
Now, what other services do you have? I know you have, you also help to save some, I think, Lucia Dawson is the director or the CEO. She was put something on Facebook about you're helping people with food.
Yes, we do help people with food at the clubhouse. And then for more information, like I said, you can call us back 239-2955 and we can give you more information on that. We do get at times plenty of food. So we do encourage people to go stop by and get that food if needed, of course.
Do you have like carne asada or anything like that? No?
No.
Anyways.
I should tell Lucy. Yeah, Lucy should start making some carne asada.
Right, there you go. So forgot to ask you, what's the hours of operation for the center right now?
Okay, so right now we are, like I said, open only by appointment, Monday through Friday from 8 to 5.
And let's say if someone is having difficulty after hours or in the weekend, is there like another phone number or is there something that they can reach out to?
Yes, well, we do have a crisis line. Telephone number there is 915-276-0126. We also have night clinic because we really don't want to interrupt, you know, individuals that are working or especially children in school. But now since they're out, you know, it doesn't really affect them. But at the time when they were in school, or right now, we do have night clinic. So we do have night clinic until 8 o'clock.
Really?
Yes,
Okay.
and that is only certain days and then by appointment, of course.
So what would you like to say before we leave about the importance? Because I know about the importance of having good mental health. Because years ago, I was diagnosed with an anxiety disorder because I lost my vision. And I didn't see it coming. You know, I was at home and I couldn't breathe. And I went to the emergency room. They put the EKG and I thought it was, you know, and then said, no, it happened twice. And they said, no, you're having anxiety. I'm like, anxiety? And I always thought the notion of anxiety was weakness. You know, I must be weak mentally. No, it's not that. It's just that sometimes the body, the chemical structure is not there to handle that. You know, you probably know more than me from the brain. But the point is, what I'm trying to say is, don't be afraid to reach out to La Familia Del Paso if you're having issues, Miss
Yes.
Monica, right? I mean, it doesn't hurt. Nothing's going to happen.
Hurt.
You know,
it doesn't hurt, and it is very important because, you know, if it only takes, because we also provide psychosocial therapy. So once the psychiatrist does see you, then you are assigned a rehabilitation worker, and they are all qualified mental health professionals. They all have a bachelor's degree, if not a higher level of education, and they do go out to your home. Of course, with what we're going through, they are providing services still via phone. And they provide you just with psychosocial therapy, you know, coping skills, anything that you need in order for you to, you know, have a better life. They also provide that. We also have the IDD program where we help students that are transitioning out of high school into adulthood. So, you know, like when they finish high school at a certain age, I believe it's 22 or 23, they no longer allow them to be at high school. So lots of the parents are like, oh my God, well, what am I going to do with, you know, them? You know, they're going to be home all day. They're going to be, you know, getting those bad habits, about staying up all late, staying up all night, and, just sleeping in. So we have that center at Carolina that will help them after they're done with high school. We also have a Horizon clinic, so we are also serving the Horizon community out there. We're at 201 South Darrington out there. And again, we are serving that community by appointment only right now. Let's see, what else do we have? We have EP Noble. Our EP Noble is located at 5000 Alameda, and that's right across Texas Tech. And that's basically like a day program. Once you complete services through the intake, then you can go ahead and attend that facility. And it's a day program. They have groups, they have psychosocial therapy groups, they have a nurse, a full-time registered nurse there. They provide breakfast, lunch. They also have activities, and transportation is also free to and from.
Wow. Hey, calling folks, not only you, but if you feel that maybe a family member is having difficulty, reach out. It's not only for you folks, your mom, your tia, your brother, your neighbors. Because you could tell sometimes, uh-oh, something's not going, good. So reach out to the Familia Del Paso. You want to say anything?
I'm sorry, Georgie. And us as like Mexicans, we're like, oh no, I'm not crazy. That's not me. Oh no, they're gonna think I'm crazy. In reality, guys, it's about yourself. If you can't take care of yourself, you're not gonna be able to take care of anyone else. Exactly. So you might as well go ahead and make yourself priority and make sure that you take care of yourself first. And if it takes only an appointment, maybe you come to the appointment and, the psychiatrist feels, oh, you know what, nothing's wrong. Maybe you can just go ahead and, feel better with coping skills. Or, it's not that once you come, we're going to go ahead and start services, because that might not be the case. But if in case the psychiatrist does feel that you do need further services, then of course, then the options of medication, of psychosocial therapy, and everything else will be offered to you.
The coping skills, Ms. Monica, they've helped me, because when I was diagnosed, they had sent me to a psychiatrist. Is that what it is?
Yes.
And he showed me about if I feel an anxiety coming on, to do coping skills, and it helps.
Yes, it helps.
It really does help, and that's what I'm saying, folks. If there's help out there, and if you're eligible, if not, there's self-pay. There's no reason to reach out to the Familia Del Paso and just to see if you're eligible. If you meet the requirements to be seen, and so before I went to go to the clubhouse, my cousin Yvette, she was part of the clubhouse, and man, she loved it. For many, many years, she loved going to the clubhouse. They gave her food, they had lunch, and then provided transportation. So can you give the phone number one more time, Ms. Monica?
The telephone number is 915-239-2955, and ask for the intake department.
And before, I didn't ask you at the beginning, what's your position there?
Me, I'm an intake and outreach coordinator.
Oh, okay. And then, so like I said, folks, you just people like Monica, she really does care. Just not because she's my cousin, but she does care. She was kind of mean with me because she was my boss at the workforce, but she was mean there. I will say that. Not really. But anyways, anything before we go there, Ms. Monica, you want to say?
No, nothing. Just really encourage yourself. Family members, anyone that really needs help, we're here to help. And don't worry about what anybody else says, what anybody else thinks. The most important person is yourself. Yep, so if you need the help, take care of it and take care of yourself.
And Ms. Monica, you made a good point. I didn't think about it. Let's say you're a parent and you have kids and you having issues, mentally, whatever you think it is. Like you said, if you don't take care of yourself, you won't be able to take care of your kids. Right. And that's why it's important just to reach out, and maybe there's coping skills. You never know. Maybe but at the end of the day, look out for seek help. It's not a bad thing.
Right. Yes. And also, where you stating that also about the parents, because our children, they see what we do. So if we're not, implementing good coping skills, then, eventually if they go through the same situation, then they're not going to also know how to cope. And it's going to just be a cycle that we're not going to be able to stop. So if we can stop it with ourselves, then, we should go ahead.
Very good point. I never thought about that. You're right. Because if the kids see that, it's just a vicious cycle. You're right. Huh. See, that's why they pay you the big bucks there, Miss Monica.
No, we should ask Lucy early. Give me more bucks early.
Right. Well, thank you for taking the time to do this Zoom session. We're doing this to meet the requirements of the, because, well, let me ask you about that. You know, there's just right now, there's a stay-at-home order right now, but Friday is going to be lifted.
Yes.
Do you think, in your experience, that that's going to really trigger a lot of people who have mental health issues regarding going out to the public or interacting with others? I mean, I am.
Sure. Yes, exactly. I know that even if they do allow us to move forward with that, I'm sure that there's going to be a lot of people that are probably not going to rush into it, just taking precaution. I know that's going to take a while for many people to really get back into their routine that they once had.
And that's like me. I haven't been in a vehicle like in 6. I might get car sick when I get in the car.
And,
But
and there's
anyways,
and unfortunately, there's a lot of individuals that they got used to working at home. So they're like, oh man, I have to go to work now. Like, so it's going to be
they want to stay home in their pajamas. Yeah, I hear
right.
you.
Yeah. Yeah.
Well, Ms. Monica, thank you, ma'am. Like I said, they're open from 8 to 5. The number
Yes.
is 915, of course, 239-2955, right?
Yes, that is correct.
Okay. And just for me, just to let people know, the El Paso Fighting Hunger they're starting a pilot program where if they need help, they can't leave the house because they've been diagnosed with the virus, or if they have a disability, a mobility barrier, they can't get food, they're more than welcome to call 915-298-0353 and let them know that you're having, issues regarding mobility, or if you're disabled and you can't get to a food bank, and it might help you. And then one thing, Miss Monica, I don't know if you know this, but Miss Lucia Dawson, we started a hotline. It's called our Community Disability Network, and you guys are in that program. You're under number 2. So if someone's having these issues regarding our assistance in mental health, the number for us, for the community healthcare or community network, is 915-533-6080, and La Familia is number 2. Press 2, and it'll forward you to their number. So like I said, there's a lot of resources. People reach out to them, and then and at the end of the day, it doesn't hurt to get help if you need it, right?
Yes.
So we're gonna go and leave the Facebook Live, Miss Monica. Just give me a second, folks, because I want to navigate with my computer and don't know where I want to go. So give me one quick second. Miss Monica, if I hang up on you, thank you very much.
Okay, thank you.
Thank you, Ms. Marjano, for the sign language. Appreciate that. So I'm going to go and let you go now, folks. And Ms. Monica, thank you, ma'am. Say hi to your mom, please, and we'll talk to you later.
Okay, thank you.
Bye-bye.